Hello, and welcome to 30 Minutes. I'm Patty Stalker. If you're like me, you may be curious about acupuncture, how it works, what it's used for. Is it becoming more widely accepted in the Western world? Is it covered by my insurance plan? And how can it actually benefit me? Well, today I will help answer all of those questions and more when we visit with Cynthia McMahon King. Cynthia is an acupuncturist with an office in Westford for the past 25 years. She's an expert in the field and will not only tell us about the benefits and uses of the thousands of years old practice, we will also sit in on a session and see the practice firsthand. It's going to be a great show, so please stick around. It's 30 minutes. Cynthia McMahon King, thank you so much for joining me today on 30 Minutes.
Oh, thanks for inviting me.
So, Cynthia, as I mentioned in the opening, you are an acupuncturist. You are the owner of the Healing Point here in Westford, and I think you're celebrating your 25th anniversary this month.
That's right.
And from someone who has never had an acupuncture session before in my life, but I'm very curious about it, and I always think of it sort of as a pain or stress reliever, but we're going to find out today there's way more things that acupuncture can treat than those two simple issues, correct?
Right, right. Initially, when acupuncture was first brought to this country, it was used more for stop smoking and pain. Those were the two big things.
Now, when did it come to this country?
I don't know the exact date, but it became popular in the 70s when Nixon went to China, and one of his staffs had a health issue and was treated with acupuncture. Then it was publicized, and I think it was in Newsweek, and people became aware that it was used for more than just stop smoking and pain. And through the years, I've actually, like I said, have been in practice for 25 years and seen a great deal of change in the time. But before, actually, acupuncture needles were investigational use. And that was one of the reasons why we couldn't get insurance coverage. And they have, I think it was in '86 that they came out of investigational use, and now we see more insurances covering acupuncture.
Explain what you mean by investigational use. I'm not familiar with that term.
Well, there's drugs that are sometimes used for investigational use until they're proven safe.
Oh, okay. Sort of by the FDA or something like that.
Okay. Some instruments are investigational use until you have enough. I mean, there's been millions of people for thousands of years that have been treating with acupuncture, but we still have to go through our own systems here in the United States for approval. So since that time, acupuncture has been utilized much more. The World Health Organization came out in '96 with a whole list of symptoms that could be used for acupuncture. One of the main things was for nausea with chemotherapy.
Oh.
And they also used it for morning sickness and nausea and pain with dental work.
Oh,
those were the big things way back when.
Wow.
And today you see a lot of acupuncturists that have positions in oncology centers, so that people that are receiving chemotherapy or radiation can get acupuncture treatments, and those treatments help support when you're getting chemotherapy. There's nausea. Sometimes there's pain due to the cancer. People get depressed. The acupuncture is very effective for that.
You mentioned to me when we were talking, when I was in your office a couple of weeks ago, about post-traumatic stress disorder. It's being used for as well, correct?
Yes, and veterans are some of the people that are utilizing that the most. Also, our first responders, like the police,
Right.
firemen, and then just, you know, people that have been in situations. I actually had a patient in my office this morning before I came here, and this gentleman had his young child, I think the child was just 2 years old, and was having multiple seizures, like maybe 20 a day.
Wow.
And this went on for a long period of time. Now this gentleman has difficulty sleeping because he was always worrying about
panic.
the child.
Yep.
And I said to him, we had talked about this before, but it clicked with me that really this person was experiencing post-traumatic stress disorder. So it's not just with our first responders or people that have, you know, the veterans that have gone through wars and you know, our rape victims have that,
Right.
but domestic abuse. But even something as a dad being upset and worried about their child and always listening to make sure that that child is still alive.
Right.
So our military actually are supporting acupuncture,
Okay.
and the New England School of Acupuncture, which is located in Newton, received a grant of 1.1, I think it was 1.1 or 1.3 million dollars to do research with Gulf War illness.
Oh.
And part of the symptoms of that is the post-traumatic stress, but a lot of other things that, symptoms that are related to that. And the studies, the research came out so favorable that they were given more money. And you see even in our military today that they carry acupuncture needles on the battlefield.
Wow.
So there's a thing known as battlefield acupuncture.
Wow.
And it's very interesting.
I don't remember that in MASH.
Yeah. That would have been a good thing to
good.
put on.
Yeah, really. Yeah.
But you know, when acupuncture first started in China, they talked about the barefoot doctors. And so they would carry needles and go through the, you know, the different fields and the farms and treat people. So it was very inexpensive. You could treat a number of people at one time, and that's how it was practiced.
Wow.
Now, today, in China, you'll have in a hospital a floor with Western medicine, a floor with TCM, or traditional Chinese medicine. And sometimes you may even have an herbal garden outside in the hospital that they use to fill herbal prescriptions for their patients that are in-house. And the doctors of TCM and the doctors that practice Western medicine speak together and decide on how to treat the patient. And you'll see a lot there with anesthesia, which is fantastic because it can be very dangerous anesthesia. It increases the time of recovery when you have anesthesia, and then somebody has to deal with the grogginess. Well, in China, they'll do some surgery using acupuncture.
Wow.
And so
so it actually, so that you can't feel the surgery being done?
Exactly.
Wow.
And then the patient is awake.
Oh.
That's one of the things.
Yeah.
You have to be comfortable with that. But the patient is awake during the surgery.
Having 2 C-sections, you're awake, so I can totally relate to that.
Yeah.
That's major surgery.
Yeah.
And you know, you're awake for it. So.
But your recovery time is much quicker when you're not taking,
Drugs.
having anesthesia.
Sure.
So,
Well, let's face it, we're incredibly dependent on pharmaceuticals in this country. So I'm really all for something alternative to that.
yeah, and you know, you're seeing people, I think in the time that I've been practicing, in the last 5 or so years, when the drug companies came out with their commercials with
With the side
effects.
My kids always say, I would rather have the whatever the issue is than all those side effects, Mom.
Right.
You know?
Well, since that came out, I think people have really realized, hey, wait a minute, I need to take a look at this.
Right.
What am I putting into my body? And looking at other modalities to use that are more natural. So we're kind of going back. We used to be a nation where the pharmacists used natural substances and dispensed those. And then, you know, with penicillin and antibiotics, that was only in the 50s. Then, you know, Western medicine and prescriptions became the miracle thing because it was instantaneous. Now we're reverting back to more natural, I think, in our environment and in our bodies and the way that we look at the earth and how we live. So
I absolutely agree with you. I mean, we have so much more knowledge now of chemicals and what they can do, like you said, to the environment, to your body, you know, to the air, to the world. So, and let's face it too, everything that you put into your body comes out again. So in the way of pharmaceuticals, they're in our streams and water supplies because we're, you know, passing them out that way. So not to get too graphic there, so I think everyone knows what I'm talking about. So I really, like I said, I'm very unfamiliar with it, which I'm embarrassed to say. But you know, and a lot of it has to do with insurance coverage. Let's face it, people, if they can get it covered by their insurance, they don't want to pay that out-of-pocket expense. But it seems like more and more insurance companies are starting to accept and cover acupuncture as treatment. Am I correct?
probably right now maybe 25% are covering acupuncture. Some have discount programs. And I just learned yesterday, I was at an insurance seminar, and Blue Cross Blue Shield, if you have that, them as your medical insurance, you can request an added policy that will cover acupuncture.
Oh, okay.
And actually, it's not that much money. The figure that I was given was an additional $25 a month. I think it's probably less. This study was done in 2006.
Oh, okay.
I think the more that they implement it, there's studies that have been done in California and Maryland, and then also we have the UK. The British have that in their health insurance now. They have national health insurance. They have decided to put that in as coverage because they found that it saves so much money.
In the long run,
Right. There have been some studies that show for every dollar that you put in for preventative and they used acupuncture as one of them, that $10 is saved.
Wow.
So that's
On the other
a
end,
tremendous savings.
Absolutely.
So we have a bill up, and it's in the Ways and Means right now at the State House, and they are doing a cost analysis study, a second one, to find out, and I don't even know all the criteria that they're using. They don't divulge that until they get their findings. But we are trying to get that passed, and part of it would be to cover for pain, nausea, PTSD, and substance abuse, which has become a big thing. We talked about pharmaceuticals, and it's really pain medication that's been a problem. So, and acupuncture is fantastic with addictions as far as alcohol and drug, stop smoking.
Jeez. It's incredible.
Yeah.
So I was in your office a couple of weeks ago, and you had a young man, Mackenzie, come in, and we watched George, the cameraman and our production director here, and I. You were nice enough, and Mackenzie was nice enough to allow us to come in and get an idea of an acupuncture session.
Right.
And so why don't we'll stop this interview. We'll cut to that. We'll take a look at that, and then we can come back and discuss a little bit about Mackenzie's condition and why he was in seeing you. Sound good?
Great.
All right. So we're going to cut to the tape and watch a little bit of an acupuncture session with Cynthia McMahon King.
So Mackenzie's in here for treatment for his low back issues, and at a young age he did a lot of gymnastics and injured his back, and he's been suffering for a number of years, and he's done chiropractic and other modalities, and he came to me about 6 months ago, and we started to do a few acupuncture treatments, and he's gotten a lot of relief from that. So I'm just going to show you some points in the back that we use and along the legs, and I'll explain a little bit about what each of them do. So first, just a little alcohol on the areas that we're going to needle. And I use all stainless steel sterile disposable needles. When they go in, the patient will feel like a little pinch, or you may not feel anything at all. If you think about like what a mosquito bite might feel when it first, that's about the most you're going to feel when a needle goes in. So these are the needles, and they're very fine and thin and flexible. And a lot of times you can't even see them. People don't even feel them going in. But we're going to use this point here in the low back, right in the sacrum area, which is right here, because this is where Mackenzie's issues are. And this little tube that you see guides the needle in. And by using the tube, you don't have to use as thick a needle. And you can use a thinner needle, and it's more comfortable for the patient. So along the back, there's what we call bladder points. It's the bladder meridian, or the energy pathway. And each of the points along the back represent different organs and meridians. This here is the large intestine, but the reason why we're using it is because it really helps the low back as well. And the next point I'm going to do is the kidney point. And in Chinese medicine, the kidneys rule over the skeletal system. So by needling the kidney point, we're actually strengthening the skeletal system. And this is bladder 18, which is the liver point. And the liver rules over tendon, ligament, and muscles. And what happens with low back pain a lot is that the muscles tighten up and they pull on the vertebrae, and that causes a lot of the discomfort. So we're relaxing the tendon, ligament, and muscles, and we're strengthening the skeletal system. Down here at the back of the knee is one of the main points for low back problems, right here. And we do bilaterally because the meridians run on both sides of the body, but you can actually treat one side and affect the other side. So say for instance, if a patient had a cast on, or if the area was covered that had an issue, you could treat the opposite side and affect the side that is bandaged. This point here is spleen 6. It's a crossing point for the kidney, liver, and spleen. And again, we're reinforcing the kidney and liver meridian. And here is bladder 60, and it's called the aspirin point. It's a great point to do for a lot of different pains. And the last point here is gallbladder 34, and that's the control point for the tendon and the ligament and the muscles. So we have the liver meridian, which is strengthening them, and this is reinforcing that as well. The needles will stay in for about 30 minutes, and I'll do a little heat on them, which is called moxa, which is an herb that we use. It's called Artemisia vulgaris, And what that does is it moves stagnation. So the Chinese believe any type of pain is due to stagnant qi or blood. And when you use the moxer, it moves that stagnant qi or blood through the meridians and gets rid of the blockages that are in the system. It also tonifies or builds, so we want to build up the kidney and the liver meridian. And I'll show you a little of that as well. So this is moxer, and it looks like a cigar, and it's a combination of the herb Artemisia vulgaris with carbon, and the carbon is put in so that it doesn't smoke all over the place, and that's why this looks black. And I'm just going to warm the tip of this and get it going, and we're going to hold it a couple inches from the skin and tilt it towards the needle, warming the needle so that the heat goes directly in the needle. Now you might be thinking that any type of heat could do the same thing, but it's actually the properties of the herb that has the therapeutic effect in the body. If you used a cigar, you're not going to get the same effect. Okay. So that tapping you hear is just tapping the hot ashes so that they don't fall on the skin, but you hold the moxa pole just a couple inches from the skin, and you're going to tilt it towards the needle so that the heat goes directly into the needle and into the acupuncture point. And it's quite amazing, this small diameter of a pole can create so much heat on the body. And it's very relaxing too. And I'm also going to moxer the point down here because this will strengthen the meridians or energy pathways as well. So what not only happens with acupuncture, each point has a very specific action and effect, but physiologically, what's happening in the body is you're getting the secretion of endorphins, serotonin, which will help the pain, and also cortisol, which is the body's own natural cortisone. And if anyone has ever had a cortisone shot to decrease inflammation due to a tendinitis or a bursitis, this is having your body do the same thing that that cortisone shot does, but in a natural way. So we would leave these in for 20 or 30 minutes. The patient stays in the room with quiet music, low the lights so that they can relax. And when that time is up, then I would come back into the room and just take the needles out, and the patient is ready to go home. And that's it.
Tell me a little bit about Mackenzie and in his background and why he is having this acupuncture work done.
Well, Mackenzie, when he was younger, did gymnastics, and so he has back pain every day. And he came in and he tried acupuncture, and after the first session, he had relief. He said,
Wow.
he didn't have the discomfort, he had a little left. So I did a second treatment, and we only did a few treatments, and it held. So now he'll just come in and see me like maybe once a month, or if he does some type of work.
Where he hurts his back, right?
Exactly.
Wrenches it, yeah.
Exactly.
I can relate to that.
Yeah.
So if someone was interested in coming in and or was having an issue, like you said, stop smoking, drug addiction, pain?
Allergies.
Allergies.
Yeah,
No,
yeah. I do a lot with allergies. I can eliminate food, chemical, and environmental allergies.
Wow.
It's a combination of acupuncture and a little bit of homeopathy. But it's great for things like ragweed. People have ragweed now, August to the first frost. Mold from the leaves that fall, and we get mold allergies. A lot of people are troubled by dust and dust mites this time of year.
Hello.
Or, you know, animals, cats and dogs.
That's common.
So any kind of environmental, chemical, you're a hairdresser and the chemicals, or you're around chemicals all the time and you become sensitive, it's very effective for those.
Seems like it pretty much, you know, pain and, like you said, allergies. And let's talk, October's a big month for you. It's your 25th anniversary.
Right.
And it's Breast Cancer Awareness Month.
Right.
And I know you work with women who have had
breast cancer. Right. I started out years ago, probably maybe 15 years ago, with the Healing Garden. It's a center for women with breast cancer in Harvard. Just within the last 5 years, they've expanded and made it for all cancers. But women with breast cancer really appreciate the treatment, and it helps them a lot with some of the symptoms that they have. It can help, as I said earlier, with the nausea and vomiting or depression or pain. It's also great for lymphedema. So a lot of times when a breast is removed, there may be a blockage in the lymph glands, and you might have noticed sometimes somebody will have like an elastic brace around or a swelling in the arm or the hands, and acupuncture can get rid of that swelling. And so it's very effective for that. Wow. Another big thing for this month is it's acupuncture and oriental medicine.
You have an open house
day,
coming up.
Right.
Okay, let's talk about that. Let's get that out there. When is that?
That's October 24th.
Okay.
It's Friday. And from 3 to 6 o'clock at my office, I'm asking, or I'm offering for anyone to come in and try acupuncture. And what I'm going to do is I'm just going to do a very simple treatment that helps with stress. And if you don't have any stress and you just want to feel more relaxed, it's good for you too. And
you said you're going to even allow people to, you know, feel what it's like to have the needles put in. I mean, you could see from when we watched the session, you know, it's very slight and obviously not uncomfortable, but people can try that. You said you're...
Right. Well, the sessions that I'll do at the office, people will just sit in a chair and we'll put a few needles in ears. But also, you know, I'll show you some needles, and I know we saw them in that segment. They're so fine and thin.
Right.
They're the thickness of the human hair.
Really?
And for people that know, like, they are actually 0.18 millimeters in diameter. So that's very, very, they're flexible, and I think I showed that.
Yeah, you showed that. Just so when people say, oh, you know, I hate needles, it's nothing like that.
It's basically like a little mosquito bite.
Right.
Or you feel nothing at all.
So that's October 24th. And what's the address of the Healing Point?
It's at Old Boston Square, 270 Littleton Road.
Right before Bell's Restaurant, if you're heading toward Littleton, on the left.
That's right. And I'm unit 29, so I'm on the right-hand side when you come in about halfway down.
And your website?
thehealingpoint.us.
Okay, great. Cynthia, I'm so happy to have you on here, and I learned a lot about acupuncture, and I'm sure a lot of people out there watching feel the same way as I do. It's a lack of knowledge.
Right, so come and learn some more on Friday, the 24th.
Friday the 24th.
Yeah,
Cynthia McMahon King, thanks a lot.
Okay.
And thank you for joining me today on 30 Minutes. I'm Patty Stalker.